The appendix is a small tube-like organ located in the lower right side of the abdomen. While the function of the appendix is not entirely clear, many medical experts believe it plays a role in the immune system, helping to protect the body against infection and disease. Despite its potential importance, the appendix is not considered a vital organ, and in many cases it can be removed without significant consequence. In fact, appendectomies, or surgeries to remove the appendix, are one of the most common surgical procedures performed worldwide. However, when the appendix becomes inflamed, a condition known as appendicitis, it can cause severe pain and other symptoms that require prompt medical attention. The following are some signs and symptoms of appendicitis to look out for. Abdominal pain that starts near the belly button and moves to the lower right side of the abdomen. Loss of appetite, nausea and vomiting, constipation or diarrhea, and finally, a low-grade fever. If you experience any of these symptoms, it's important to seek medical attention immediately. If left untreated, appendicitis can lead to serious complications such as a ruptured appendix, which can cause infection and other health problems. To diagnose appendicitis, your doctor may perform a physical examination, blood test, and imaging tests such as an ultrasound or a CT scan. If the diagnosis is confirmed, the recommended treatment is usually an appendectomy, which is a surgical procedure to remove the inflamed appendix. While the removal of the appendix may sound scary, it's a safe procedure and a routine procedure. In most cases, patients can go home the same day as the surgery and they resume their normal activities within a few weeks. If left untreated, appendicitis can cause serious health problems, so it's important to seek medical attention if you experience any symptoms.